Welcome to Navajo County Connection. I'm your host, Daryl Seymore, Supervisor for District 4. Today our guest is Cathy Solomon and Janelle Linn from the Navajo County Health Department. Let's just give a bump across here, guys, okay? And here we go. All right. Thank you so much for being with us today. You know, we have a serious discussion that we want to share with the public today. It's something that's on everybody's mind. And I'm really grateful that you came so we can kind of clarify exactly what you know, because your knowledge about this is greater than what the public has. And so if you want to just share, whoever wants to start off first, a little bit about, you know, what it is that you know about this coronavirus that we have.
Firstly, we'd like to explain that coronavirus is not new. This particular strain of coronavirus is new. However, the family of coronaviruses has been around for a long time. People have heard of SARS before. They've heard of MERS before. Those are in the coronavirus family. They are more virulent strains. And then there are 4 strains of coronavirus that cause very mild symptoms, common cold type symptoms. So this just is a new strain of coronavirus, not a new virus in general.
Okay.
So it's important for people to understand that.
Let's understand a little bit about how it is transferred, or how a person may come down, or do they have to be in contact? Do we know how it spreads?
I'll take that one. So it is spread by droplets. People sneeze, they cough, or something like that, and it comes out that way. So it can stay in the air for a little while. It is not considered an airborne disease, however. It can be on surfaces for a while. So if somebody is in the lunchroom eating and they cough or sneeze all over the table, and then somebody else comes in and, you know, they pick up whatever there and eat, then it can be transferred that way, which was one of the reasons that we ask that you wipe down common surfaces often to help mitigate that. But it is through coughing and sneezing generally. Okay.
And what are some of the things that a person can take precautions in their daily hygiene? Is there anything different they should do, or just let's reiterate what are the steps to help a person become more immune from it?
Well, one of the things is the fist bump we started out with, or, you know, we're encouraging things like that instead of handshaking, because people may have germs on their hands. We're encouraging people, like Cathy mentioned, clean your solid surfaces or things you touch frequently. Steering wheel on your car, you know, the handle on the shopping cart at Walmart. Carry some disinfecting wipes with you and just clean surfaces that you would touch frequently. If you are coughing or sneezing, get some tissues and try to carry with you. Cough or sneeze directly into your tissue and immediately discard that tissue and then go wash your hands. We're encouraging people to wash their hands as frequently as possible. A 20-second hand wash, really aggressive hand wash, is what's recommended. If hand soap is not available in water, then you want an alcohol-based sanitizer and use those things frequently. And then we're encouraging, you know, if you're sick, please stay home. Don't take the risk of spreading the disease to others. And even if you're not sick, avoid some things. Practice some social distancing. You know, if there's a huge gathering and you don't have to be there, think about, maybe, do I really need to be there? That's things to stop the spread of disease.
Right. So I can social network still on Facebook. I just got to keep personally away from people and things. But help me understand, or the public understand, that as far as when we do get it, or what the symptoms, what would be some of the early symptoms of it?
So generally people will start out with, say, a runny nose and a cough, something like that, which can either stay at that, be very mild. Some people don't even know they have it. So it can mimic at the beginning like allergies or the flu or something like that. But with the coronavirus, it, for those who are more severe, will progress into a fever, difficulty breathing, acute lower respiratory issues such as pneumonia or respiratory failure, those kinds of things. And those are the people that you hear about who are in severe condition.
Okay. If I came down with some of those symptoms, should I just stay home and weather it, because there's really no medicine that they're going to be able to give me? So going to the doctor to confirm that I have it would be a better mindset for me, but then I'm also exposing it to other people possibly. So walk me through what might be the best process here.
Well, we have to remember, number one, this is in conjunction with flu season. So you may or may not be infected with corona. So we're encouraging people, if you have mild symptoms, the runny nose, the little cough, feel a little feverish, but not a high fever, try to stay home. If symptoms progress, then you need to seek medical attention. We are asking people, though, to utilize things that would help aid in the stopping the spread of disease. So reach out to your provider through telemedicine, if that's an option for you. If you must go into your provider's office, please call them first, and they will direct you how to do that in a way where you're least infectious to other people in their waiting room and to their staff. And especially if you need to go to the ER, please call them first and ask how they would like that to be handled.
Those are very good tips and suggestions that we have in place. As far as the county health department, how prepared are we if we had an outbreak and it became serious? What are some of the measures that we're going to implement or be able to do to help the public?
In general, we have response plans in place. We have pandemic response plans in place, and we practice those on a routine basis to ensure that we're prepared for when and if an event happens. We are confident that corona will come to our area. We will see COVID cases. We're just trying to lessen the impact of that. So we are prepared. We're prepared with materials, education, guidance. We have weekly meetings with our various community partners, healthcare organizations, county administrators and elected officials, school nurses and school superintendents, and we're in touch with our partners on a weekly basis to keep people informed. We have a protocol in place for if we suspect a case, how the healthcare providers, they're informed on how to contact us, and we navigate that process together.
Okay, because it almost could cause a domino effect, though, was once the hypothetical, if it came to our area and we still have emergency response teams, if they got infected, then that becomes more of a challenge. Mm-hmm. But we have to understand it isn't a type of illness that's also going to be a plague of death, right, or a plague of serious injury, or going to leave you with a disability or something. It will pass, and you're going to be, your health in all cases that we have seen so far will be restored back to normal.
Correct.
Prior to doing it.
70% of cases have recovered and they're returned to their normal day-to-day activity. We are, we're just really trying to stress to people, be prepared. We are prepared. There will be people who get sick. There will be people who, so we need to have those plans in place, but it's not a need to panic. Seek your information from credible sources. Maybe not, your friend on social media. Right. Seek a credible source for your information.
And I think on the county website, we have that information. Everything that we've talked about here today is there. The ways to avoid the social distancing as well, mm-hmm, as the washing. Now I want to just go through and maybe have you guys sing happy birthday, because when we talk about washing our hands and how long we should wash our hands, I guess the good thing that I've kind of learned through this is we're supposed to sing happy birthday twice. Yeah. And if you do that, that's about 20 seconds.
Right.
It took me 23.6.
You're an overachiever.
I'm an overachiever on that. But I think it's a good indication of just something to run through your mind. How easy is that to teach the children? Mm-hmm. Okay, you're going to wash your hands, you sing happy birthday to yourself 2 times. I think it's those type of things if we can initiate, and it's these type of good hygiene things that if we will continue. But it's just like you go into a public restroom and sometimes there's not soap in those dispensers. Right. They have them. And so as business owners and as people in public places, we need to step up some of our janitorial things and make sure that we are doing things to do our part. Everybody can help in this thing, or everybody can panic, and it's kind of like the old cowboy that's out there herding the herd. He's safe as long as he's back here, but if that herd turns and panics, we can actually cause more damage and more hurt to our society by panicking over something that we shouldn't panic over. I mean, although they call this a pandemic, it doesn't mean that we're supposed to panic and go off rogue or go rogue on something there, because we are all safe still. And I think on that side of it,
I know a lot of people watch the news and they see like the travel is being shut down from certain areas and for a certain amount of time, and things are being canceled, large group activities are being canceled, those kinds of things. That is not to say that we're at the stage that it is necessary to do so. The reason that those are happening is to get out ahead of it so it doesn't get to that point, so that we mitigate things that are coming ahead. And there's a fine line, and it's hard to pull the trigger at certain times. It is a line between, are we going to stop this in time to slow it down so that it doesn't cause effects to the economy that are huge, that cause more illness than what needs to be done, overwhelm our healthcare system, versus these measures. What is that going to do to our everyday lives? How is that going to affect our working communities? What is that going to do to the economy? Those kinds of things. And so just keep in mind that some of these things are being done to get ahead of it, so we are being proactive as opposed to reactive.
Reactive. Very good suggestion. So we don't get to watch the NBA anymore, which the Suns were close on there. They had a possibility. The Final Four has been closed. There have been some meetings of religious organizations that have been canceled or postponed until further notice. All those things are great things that happen. Now we still had to have this meeting today because we want to get this out to people, but that doesn't mean that a lot of people have to come and attend meetings, and if you can avoid some of that, definitely do so with that. Is there anything, we don't want to cause panic, but this the common things to have if maybe you were going to be quarantined? What would a quarantine situation be like?
We would only consider a quarantine situation as a last resort. We would speak to individuals involved. A lot of times these individuals, they may be in the hospital. There are going to be measures taken to isolate them from other patients. Staff will be taking special precautions as they care for these individuals so that they don't pass the virus. So things like that. We would only enact a quarantine as a last major resort if we had a highly infectious individual or situation that was not compliant with when we asked them to please self-quarantine and self-isolate, which means stay home for 14 days if you're not sick enough. You may not be sick enough to be in the hospital, you feel well enough to be out and about, but is it wise to do that? And most people, we expect them to be very compliant with that. We are encouraging businesses to perhaps look at their continuation of operation plan. So if they have key personnel who are staying at home for 14 days because they have the sniffles and they're trying to be a responsible citizen, can you allow that person to work from home? Are there things that you can do that don't disrupt your business but allow these measures to be taken? We encourage people, you do want to have, some food items on hand and some things, but you don't need to go clear the aisle at Walmart of toilet paper, and be reasonable. You don't need mass stocks of supplies, but you should have things at home enough that if you were asked to self-isolate for 14 days that you could be prepared to do that.
Right. I think for most of us have access or know somebody who has access. If all of a sudden we found ourselves in a quarantine situation, I can pick up the phone. Hey, could you drop by some water or drop by some toilet paper, or drop by something here? And it doesn't create a panic. I can tell you that we would be happy as a county, as a city, to answer any of those needs if any of our citizens had that situation and couldn't get out, but they needed some basic supplies. We'd do that.
That's a good point. There are people who are at higher risk of, if they do get it, having a more severe case, such as those who are over the age of 60, those who have comorbidities such as heart disease or lung issues, diabetes, things that would make your health already, your body be dealing with something severe already, and then to add that on. So when we go and we buy up everything, what we do is we make it impossible for those who particularly need it to be able to get those things. Right. And you're right, we do have people who could go and get those and bring them in. It's very common to have large families or helpful neighbors or church systems in rural areas such as ours. So that's also something to keep in
feel
mind.
free to reach out to anybody, your neighbors and things like that. You're not putting them in risk. They're still out there and things. But you are correct. Let's put this a little bit more in perspective. I think in the United States we have somewhere around 1,000 cases. We've had somewhere probably, 40 deaths in the United States. Talk to me a little bit about the common cold and how many cases maybe we have on an annual basis and how many deaths we have from the common cold.
Common cold, I can't give you exact numbers, and we don't usually have deaths from the common cold. But flu circulates through our the world every year, and there may be 80,000 to 100,000 cases of flu with 30 to 40,000 deaths on an average year. So the mortality rate for influenza is much higher than the mortality rate for COVID. So we need to look at that and keep that into perspective. Every year during flu season, most people are going out and performing their day-to-day business, and it's the same type of a risk situation here. You just need to be doing those prevention pieces, be smart about washing your hands and hygiene measures.
Right.
Just like we would any flu season. Very
good point. We also have to realize that we have got past many of these type of epidemics that have come, the swine flu, the bird flu, all of those things that have happened, they've always happened in other countries and they've came here. So you are susceptible a little bit more to risk if you were to leave the country. I think that's one of the reasons why we have taken a stand about people coming from other countries, and we still haven't retained people from going somewhere, but just use your own judgment. And
right.
It may be real boring being on a cruise ship by yourself, but it might be the dream of a life or something. Who knows? Those things there. Well, it's good information that we have. As broad as the county is, going all the way Navajo County from down to White River all the way up to Window Rock, okay? And it's very broad. That is to our advantage a little bit. And you want to say why did I make that statement?
The social distancing piece. So, we geographically, we're very large, and that gives us the opportunity to spread out. We have a lot of rural communities within our county, and that helps with that social distancing piece. However, we do have resources available throughout the entire county to meet the needs of citizens no matter where they live.
Right. And we do have some of those nursing centers, some of those places that maybe have a little more high risk numbers. There's the majority of them will have older people who are a little bit sick and they take special needs, special care, and we've been fortunate right now to keep anything from penetrating that. So
correct.
I know that there's some measures on visiting patients. You also need to take precaution, although you feel for them, you want to be there. It also puts them at more risk if you visit them.
Correct.
And of all times, that's really hard to say, don't come visit me when I'm in the hospital, but in all reality, at this point in time, we have to rely upon the care that they're getting there right now. But I think it's wise for us to make those choices too.
It is.
Well, and you made a good point. You can communicate with people through social media, FaceTime, those kinds of things.
Right. And I think that's where maybe and I don't know if you guys have talked, but maybe it's that. Maybe it's going to those patients that maybe in their homes they don't have that technology, but a couple of people working outside, I could see how we could start putting some little helpers, feelers out there that, hey, I can go and do this, or I can assist in this way, and I can make this happen. And I think that's what's great about our county and about our cities that we live in. We can come together. We in Navajo County, this is going to be something that we'll face head on, and we're not going to panic. We're not going to be afraid of it. We are going to be able to beat this and win this and be stronger. We're going to learn more about each other, about our families, about our community, and how strong we really are.
Right.
We need to be proud of the fact that we have great medical centers, we have great doctors, we have great nurses, we have a great county health department that's over this. So that's fantastic.
Thank you.
So how many people do you work with? And tell me a little bit about your organization and how many people that you're involved with there at the county.
In the health department, there are 50 to 60 employees at any given time. We have a plethora of programs. We have, nursing services has clinical programs, so we offer immunizations to the community. We handle infectious diseases such as this. We have well woman health services. Then there's other educational programs in the county that go into the schools and provide education on things like nutrition and the dangers of using tobacco, and how to keep your body healthy, how to make wise choices. We have enforcement programs. So the medical examiner is in our office. The animal control program is in our office. The environmental health who do restaurant inspections are in our office. We have vital records. We're the person you come to get your birth certificate. We have a variety of programs, and we interface with the public every day, and we really enjoy our community and the people that we have the opportunity to serve.
Great. Thank you. Didn't realize you had so many numbers in there. That's fantastic. Tell me a little bit about your area, or you're part of this, but what is it that you see different or would like to share?
So on a day-to-day basis, we, in my area, surveil all infectious diseases, and there are quite a few of them, and that's where, like, the state and the CDC get their numbers that they produce is by all the local health departments sending them up. When these new things come out, like we've dealt recently with Zika and Ebola and all that kind of stuff, it's not like the process is new to us. We've done the process. It's just the disease that changes and the little particulars about that specific disease. So it's mostly getting your preparedness in order, your plans in order, and then when the occasion occurs, you educate yourself as much as you can. You follow the guidance from the state and the CDC and those people who've done the bigger studies and so forth, so that we can use best practices and the best ways to deal with these kinds of things. So we also use credible sources, just like we suggest that the community, the people who have questions, they use credible sources. There is so much information about something new that comes out, but not all of it is right, correct, or true. So you have to be discerning on those kinds of things. But yes, it is something that we've dealt with before. Like I say, it's just the disease that changes.
That's a very good point. As you say that, the credible news. I go back to the Wallow fire, and based upon the news reports that came, Greer, Arizona wouldn't have anything standing. Molly Butler's restaurant has been burned to the ground. Those are things that come out, but in reality, they were not true. And I think that's what causes the panic and the things that happen. Just want to share that Governor Ducey did a State of Arizona executive order. It put certain measures into place. It provided certain things that we can and cannot do, certain agencies for certain monies and things that we'll have. And so I'm not going to read these, but if you want more information, we'll have that about the declaration of emergency that was stated, as well as the executive order we can go into. But one of the things that we have noticed too, that I just want people to be aware of, is the fact that I immediately need to be tested because I have a runny nose. If we have a case that is more serious and the doctors feel that it needs to be tested, and we're trying to get the results back so we can immediately start a quarantine or isolation of a person, but yet we can't get the test results because we have thousands of tests ahead of it, that are all going to possibly come back negative because it was just I had a sniffle. It also because we are not prepared, or we can be prepared, but we don't have the resources maybe to handle hundreds of thousands of tests that need to be run to get the information back. So again, it's important that we test where we feel that we do have, but yet that test should be maybe diagnosed by a doctor to do the test instead of people. There have been many people that just come in and I want to be self-tested as to whether or not I have it. I don't even want to wait for symptoms or something that way. So, I think that's something that we need to be aware of too. That, we're about there with our time, and I've just appreciated the opportunity of sharing with the public, and we hope that this is something that can help, and we hope it can even save a life. And let's remember those seniors, especially at this time, those people that are mostly susceptible to this, and hopefully as we are county strong that we'll get through this. Anything you guys would like to end with?
We agree with your statement. Thank you, and thank you for inviting us here today.
You're welcome. Thank you so much. Appreciate it. Thanks for joining us on Navajo County Connection, and we'll see you next month. Who knows what we'll be talking about then. Hopefully we won't have any more coronavirus that we're going to be talking about. Thank you.